Are you ready to master the waves of medical device product development? Well, wax up your surfboard because you are listening to Inspired by Amua. And here is your medical device product development expert, that Hawaiian-hearted hostess who will help you hang 10, Megan Alonso.
Welcome to Inspired by Amua, where each week we bring you education, insight, and guidance to help you and your product hang 10 through medical product development. I have a special guest with me today, and I am actually on site in Minneapolis, Minnesota at the University of Minnesota Medical Devices Center. I just had a wonderful tour, and Dr. Art Erdman is going to bring his insight into what the center does and how it spurs on medical device innovation. So Art, are you ready to hang 10?
I am, yeah. We don't do it much in Minnesota, but I'll give it a old college try.
I actually heard last night that there is a crazy group of surfers that surf some of the lakes around here during the November gales, so I can't even imagine how cold that is.
Well, they actually do that on Lake Superior, which is on our northern border. Yes, I've seen that, and there's icicles hanging from the trees on the shoreline, and they're out there. Crazy.
Wow. So, Art, tell us how you stumbled into medical device development. I know you have an engineering background.
Yes, so my master's and PhD is in mechanical engineering, and it was really focused on mechanical design using kinematics and mechanisms and things like that. And even as a PhD student, I, for a little bit, looked at a project that would be involved with understanding spine movement, three-dimensional vertebral movement. But there was no funding. I was back at RPI. But when I got to the University of Minnesota, I very quickly began to understand that already, and this is back in the 70s, there was a lot of activity between the health science area and engineering school, because we're right across the street from one another. So within the first year, I was already working with dentistry, and then a little bit in cardiology, and then orthopedics and so forth. So I've always had the interest, and however, no training. So I'd like to encourage any engineers out there that haven't had anatomy, physiology, or any of the ologies. You can learn it on the job, and which is what I've done over the years. It's great fun coming in because I learn something all the time, and try to apply some standard design methodologies towards projects. So there's a lot that is in common that you can apply. Although working with medical devices, as I think most of your listeners may understand, is very different than designing a part for a car.
Yeah, each one of them is unique and difficult, but in different ways. And I think you're right with any of the ologies that you can take. I have seen that there is courses for that. One of the local organizations in Southern California, Biocom, they actually have a course for engineers that teaches them just basics of life sciences and gets them up to speed on that. You know, if they want to know what cell lysing is and how to engineer for that, then they pick those skills up.
Yeah, you don't. And so you have to go to medical school to learn those things. What I found early on is if I had one colleague in one of the medical school departments that was as interested as I was, they were interested in understanding the basics of the engineering, and I was trying to understand the need. I felt like I was in heaven. These days, we have tens or 20s of those people that surround the center. So we're really fortunate. There's been a lot of change over those years.
So I just finished a tour here. It was pretty amazing if you've never been, and the campus is beautiful. It's a nice summer day, warm. I don't know how cold it would be in the wintertime, but I'm glad I'm here now. But it was pretty cool because the Medical Devices Center is right in the same building practically as all of the medical offices and the school, and then the engineering school is literally right across the street. So Art, fill us in a little more on the history of this. And I know we're in what used to be a parking garage, so that's pretty amazing in of itself.
Yes, and even last week I ran into a surgeon that claimed, like many others, I used to park right here. I'm not sure if it's true or not, but yeah, they decommissioned the garage, which is fortunate to us. It's a beautiful facility. It's about 8,000 square feet, which we're told by others is unique in the world. It's a place where we can quickly prototype lots of things and do testing. It's been uniquely designed so that design teams can make good, quick progress. The worst thing you can do is you have an idea, and well, let's come back in 2 weeks when we order motors and tubing and all that stuff. Well, no. So we try to have all those things handy here. And you're right, this is right in the midst of all the action. We're within minutes of all the operating rooms and the other suites, and close enough to the other engineering facilities where we have equipment that we don't need to have here on site.
And so tell our listeners about our last stop on the tour that was pretty amazing, and I think everybody wants to hear the brain tumor story.
Okay. So the center actually has the same mission as most universities. We do training and we do outreach, a lot of outreach, K-12 all the way up, but we also do research. And one of the research projects we have is, I think, pretty cutting edge. That is to use tools of virtual reality and 3D imaging to, prior to doing animal and human trials, do virtual simulation and optimization of devices in virtual anatomy. So you may have to back up and listen to that again, but essentially we can, this is a custom-built system that we can project in 3D any anatomy, so it can be patient-specific anatomy. We can place, through using computer-aided design tools like SolidWorks, we can place devices that are prototype devices, and we can represent anything that you can write an engineering equation for in that system and literally optimize without ever going to animal or human trial. And it's a pretty special system. There are a finite number of these things in the world. What I was showing Megan is that when the MDs come in, they immediately trigger to a different use, which is very appropriate as well. That is pre-surgical planning and building prototypes through 3D printing of what the surgery is going to be perhaps in the next day. So we have been setting in process the opportunity for doing these kinds of things. So the model that I showed Megan was a slice through the human skull that is horizontal, but about through where the ears and the eyeballs are. And the reason we had it is that a gentleman was facing a operation to remove a tumor behind his ear, it was already affecting his hearing and his facial expressions, losing control of the muscles. And he was out here, and he had gotten access to his CT scans. So we use a program called Mimics, put it up on the screen to segment it, and then on a low-end 3D printer, we printed out that for him. The operation was taking place in California, so we took it out and showed his surgeon, who was quite amazed. Said, "Well, where'd you get that?" So I think routinely we're going to see these tools being used to pre-educate the the surgical team prior to surgeries. And what a great advancement of technology to make it safer and better outcomes and so forth.
Mm-hmm. Yeah, that was quite the sight to see. And back a few years ago when I had hip surgery, I had a scan, but it wasn't printed. They just showed my hip anatomy on the computer, and you could rotate it and see the whole shebang there. But to hold it in your hand was pretty special.
Yes, and what we're finding is that the parents or the guardians want to take those home. And it really lowers the anxiety before, particularly for pediatric cases, which a lot of them that we're involved with. Well, here's your child, and here's his or her heart or whatever the problem is, and this is what we're going to do. It's a communication tool that, before we had these 3D printers, we didn't do that.
Mm-hmm. Yeah. So tell us more about your fellowship program here, and I understand you're accepting applications soon.
Yes, so we have Medical Device Center Innovations Fellows Program, which we are going into our 9th year of the program. It's very exciting. It's innovation on steroids, and we look worldwide for fellows. We average about 30 patent disclosures a year, which is a lot when people come in and they don't even know each other beforehand. And probably sometime in October, November, we'll be on the street again looking for applicants. So we usually have about 2 MDs out of the 8, and we're looking for PhDs or masters, people who are folks that really have a passion for innovation and perhaps have a track record already. A couple of our current fellows actually had companies already and have put products out in the market. So it's great fun. It's a very intense program, but very worthwhile.
So how long does each one of the fellowship programs last?
Well, we go about 10.5 months, and then there's an option to continue further for further incubation. Our starting point this year is July 6th, so we're trying to match better the fellowship programs for the MDs to come in, so it's more convenient for them. And it's a wonderful program that really we take a very broad class of individuals. It wouldn't be so good to have 8 mechanical engineers or 8 surgeons. Yeah. So it's a very broad class, and we get usually about 80 applicants, and then bring in, we have a recruiting weekend in the spring. So encourage people to think about that, go online and check us out. The main web page for the center is www.mdc.umn.edu, and from there you can go to fellows. You can also go and look at our Design of Medical Devices conference from there as well. We just had our 15th anniversary meeting, 1,200 people in 3 days, and it's in the second week in April every year, so that's another opportunity to know us a little bit better.
And I understand you have one in China this year too.
Yes, so we've been asked to do one in Beijing, so the almost certain date will be the November 7th through 9th. So if anybody's in Asia and would like to come, take a look. You can find information on our webpage for that too.
So with these fellows, they're working hard on devices and early stage innovation. What do you see them struggling with that our listeners are probably struggling with too? And what are some pointers or just some advice for them to help push through those or push through those tough waves of development?
Well, I think we all struggle with so much information and technology moving so fast, and what's going to be important and what's not. We try to have them well networked also when they're here, and the program goes so fast. We tell them that the first week and the second week, and at the end they say, well, we didn't believe how quickly it goes. And sometimes, particularly for engineers like myself, it's sometimes hard to pull the trigger and make a decision.
Yeah.
Okay, we're done now. We know it can be better, but we're done now. Also, we all know about the valley of death. That is, you have an unmet need that you've solved pretty well. You've got some level of prototype, and but how do you get it out there and make sure that there's a decent chance of it actually being commercialized?
Yeah.
So that I think we all struggle with a little bit, and some of that is having good network of people, and you also have to understand what value you're adding and how you do evaluation of that value as well.
Okay, so the takeaways from that are just to make a decision, stop with the analysis paralysis, just pick the best one and move forward, and leverage your network. If you can't find someone in your network that's able to help you commercialize, that's what AMUA Service is here for. So you can check out my website, just amua-services.com. So you can always go there and keep pushing forward through all those challenges. So, Art, what are you most excited about in medical device innovation? We live in such a great time today with all the different tools available to us.
Well, I think very exciting is this 3D printing, additive manufacturing. We're doing research on that here as others are as well. I think we've only begun to see the opportunities for healthcare. So where it can really be applied is the populations that are not being affected very well, pediatric community, where you really have a onesie, right? You need one device for a particular case, or disease states that are rare, or third world opportunities where the patients are remote from hospitals. So we're paying a lot of attention to that, and then also working with our colleagues at the FDA for trying to deal with the regulatory issues. We're working with, there's a local company, Stratasys, which is pretty big in this area. You need new materials, you need better technologies, and I just think it's going to be so interesting to see how far this can go.
Yeah, I think so too. And the regulatory hasn't quite caught up with the technology yet. we're working on that.
Yes.
We're pushing them along for sure.
Yeah, and I've been to a number of their meetings, also using modeling and simulation, like finite element analysis and computational fluid dynamics for doing or passing your regulatory approval quicker with less human and animal trials is another thing that we're working on here, and that ties in as well. We've got to lower the cost of healthcare and lower the cost of getting new products to the market that are, by the way, still safe and effective. So that's a challenge, but I think I'm very optimistic that we'll make some good progress in the near future on that.
Mm-hmm. So just to recap about the fellowship program and the devices conference, and then also if our listeners want to reach out to you directly, what are the ways that they can do that? So list those sites again, and then also list your preferred method of contact.
Sure. So the Medical Devices Center, which has a lot of buttons on it, that'll get you to the Fellows Program and to the Design of Medical Devices Conference, and us is www.mdc for Medical Devices Center .umn for University of Minnesota .edu. My email is A for Arthur, G for Guy, Erdman, ERDMAN @umn.edu. So feel free to contact me, and we'll put you in touch with either myself or others. We're very anxious to do the number one job here is improve healthcare, and to do it through innovation and do it through collaborations that make sense. And I think we can do a lot better on all those things. And I just am excited about what your listeners can do to help. And there's so much out there to do. I don't look at really any group or university or company as competition. I think the more the better. Mm-hmm. It makes us all better, and a breakthrough in Tennessee will help someone in Alaska, help someone in Minnesota. So let's have at it.
Wow. So thank you, Art, for that amazing interview. And I just wanted to remind you guys, for any of those links that we talked about today, you can get there two ways. One, by emua-services.com/012 for episode 12, or our main podcast page at inspiredbyemua.com. So while you're at it and while you're on the web, everybody needs a little encouragement. Everybody needs a community to get through those rough waves we always face. So we have one for you. If you go to facebook.com and then you search Inspired by Emua, that's our group page. So you can connect with others, you can share resources, you can share wins that you've had or struggles or ask questions. So I'd love to see you in there. And until the next episode, Emua!
Mahalo for joining us. If you're new to riding the waves of medical device product development, or if you've been in development for a while already, Inspired by Emua is here to surf with you. Want to be a master of the waves? Text HANG10, that's all one word, HANGTEN, to 44222. We'll send you the most common wipeouts companies make in product development so you can avoid them and reach master wave status. Again, that's HANG10 to 44222. We publish a new episode every Tuesday, so catch us at inspiredbyemua.com. Emua,